It's been a whole 6 months since Nigeria recorded its first COVID-19 case, or what is known as the Index case, an Italian who was treated at the Infectious Diseases Hospital in Yaba, Lagos, and was discharged after a few weeks upon being given the all clear by the doctors. Many COVID-19 patients have similarly recovered after being treated in special treatment centers in Lagos, Abuja, and a number of other places in the country. The total number of confirmed cases is still just short of 50,000. Recoveries have also, according to some people, been impressive in relation to the confirmed cases. But the issue that has been most central to Nigeria's COVID-19 crisis is testing, the rate of testing. The question usually comes up regarding how well or not Nigeria has been doing with the testing. Is the modular testing approach working? To what extent have the interventions, particularly from the private sector, gone in meeting some of the most pressing needs of the Center for Disease Control as it coordinates the battle against COVID-19 in the country? What about interventions from the international community? How urgent is there a need to re-strategize? We are now being joined for a conversation around all of this by Dr. Chikwe Ihekweazu, Director General, Nigeria Center for Disease Control. Dr. Ihekweazu, good morning, and thank you for joining us on the morning show today.
Good morning, Ruben. And just to add, you guys have done a fantastic work covering this pandemic from the beginning. All of you on the morning show, Adesua, Rufai. So thank you for the great work that you all do for the country.
Yeah, thank you. And Aaron Akerejola, who is our main man tracking the COVID-19 story. But 6 months after, we'd like to ask you, how has Nigeria fared? What is the situation in the country now? And have we done well with the gradual reopening that we chose as an option, considering the fact that after the easing of the lockdown, the numbers have been going up? We are over 40,000 cases right now. What else do we need to do? What is the strategy that the Presidential Task Force and your Center for Disease Control are working on to make sure that now that even flights, international flights would resume, that we don't continue to see an escalation of the numbers?
So, Ruben, thank you very much. I know in the context that we live in Nigeria, it's very difficult to give ourselves any credit for anything. We're a country that is used to extreme self-criticism of our circumstances. And yes, there is a lot to criticize. We are not where we would all love to be as a country. But if you think back to the projections made early in the year on a potential explosion of cases in Nigeria, a doomsday scenario was built. I think, let me suffice to say that, yes, we still have new cases reported every day, but we haven't seen the doomsday scenario that was predicted. We continue to respond to this within the resources that we have. Cases continue to trickle up, but, we haven't seen that explosion. And that's credit to a lot of the great work done across this country. Gradual work. We've been criticized on small bits and pieces, but on each of that piece, whether it's around access to our call centers, access to testing, access to results, treatment centers. You can remember the riots around one treatment center. I mean, together with the states, the 36 plus 1 states in Nigeria, with every criticism that we received, we hunkered down, built on it. And I think we are at the moment, maybe we're not where we want to be, but there are no magic bullets. But the response has improved. And we're right now at a really steady state of continuous improvement in service delivery for this response. And we're confident that with the leadership provided by the Presidential Task Force that has brought together all the sectors required for the response, the leadership of the Honourable Minister continuing to guide the health sector, we're at a point where we can say we are confident that we can continue managing this situation until we get to the point where we have a vaccine, which is the only point where we can then take off our legs off the brakes a little bit.
Well, congratulations to you as well, Dr. Ihekweazu, and your team and everybody that has made it possible. 64 laboratories across the country. 6 months after, when we started, we were barely 3-4 labs across the country. But what is the testing capacity of the country at the moment? Are we meeting that capacity? And if we're not, what is the problem?
So thank you, Adesso. That's a very important question. With our labs, what we have really done is how we've gotten to this 64 is that we've gone across the country. And wherever we see, whether it's in a university, in a state hospital, in a federal teaching hospital, wherever we see just some minimum capacity, we have worked with them to quickly upgrade what they have in order to get them to the level of testing. And it's not a simple process because it's not just about equipment or infrastructure. You've got to train people. And when you train people in a hurry and you want to avoid mistakes at the same time, you have to find a balance between getting them to where you want to be and accepting that they might not be perfect, but just good enough to start. So we have diligently done this. There are 5 states left, and in those 5 states, we're working this week to get them out of the woods so we can cover the entire country in green and say we have testing facilities in every state in Nigeria. Now, right, challenges we've had really is, there've been some global challenges in the supply chain for commodities, for equipment, for reagents, but we're, slowly getting ahead of all of those. Now, what is our capacity for testing as at the moment? We have a national capacity to test somewhere close to 15,000 tests per day. We're doing 3, 4, 5,000, and maybe 6 at most, but that's what we're doing. So we're testing about 40% of what we have the capacity to test for. And this is not about the labs. This is really about the sample collection, encouraging people not to be fatigued, not to worry, to have confidence in the system, to come up when they're sick, and to provide samples to be tested, and so we can define if they have this disease or not. For the contact tracing that happens at the state level, so for every case, we would identify the close contacts and test them in order to see if they have this disease or not. So that's the first point. The second point is then the logistics of getting those tests, specimens collected to the lab. So we've been working over the last week with the state government to improve the efficiency of this. And that's why 6 months into this outbreak, you can imagine that there's a fair bit of fatigue setting in. There are people that have woken up every morning for the past 6 months, going out, collecting samples, doing contact tracing, following up on cases, evacuating cases to hospitals. So there is a bit of fatigue across the country. So we've really worked. I just had a teleconference with the state epidemiologists. We've been in contact with the Honorable Commissioners of Health just to enable them encourage their teams and not to give up. But at this point, I really want to remark about the incredible efforts of the government of Lagos State. When you think about a state that has risen to the challenge, despite the numbers, up to now, 30 to 40% of all our confirmed cases are still in Lagos, but we still get close to 1,000 samples collected from Lagos State consistently every single day, every day. So something that must be learned from Lagos. Yes, they have a bit more resources than many other states, but they have done an incredible job. And congrats to all of them, but also to Kano State, FCT, Borno, Plateau. I mean, there are states that have really risen. And even states like Cross River, to be honest, that were a bit slow in the beginning. Over the past few weeks, where they've really come to the table and joined the effort, the numbers have demonstrate that when there's a will, there's a way. And so what I'm saying at this is not just NCDC. This is really a federal government parastatal working hand in hand, hand in glove with state ministries of health, departments of public health across the states to show that when there's a collective effort in our country, we can move things forward. But my final point on this is, yes, you started with the word congratulations, and I take it on behalf of all the healthcare workers working on this. But we're by no means out of the wood. What we've realized is, we started this as a sprint. And when you're doing a 100-meter sprint, you need a certain level of a certain type of skill to get over the line. But we've had to transit from a sprint approach to a marathon. So defining what are the skills that we need for a marathon, how do we pace ourselves to keep running even when we're tired? And that's really the transition happening across the country, realizing that, best case scenario, we have a vaccine sometime next year. So from now to then, how do we organize ourselves to sustain this response while allowing critical parts of the economy to open so that we can sustain ourselves as a country?
I mean, I read your very spirited article on This Day newspaper, and I was really excited about it. I'm sure definitely a book is somewhere in the offing after all of this ends. And in that article, you kept on using the word, we need to keep pushing. We need to keep pushing. And you talked about, challenges. Let's talk about those challenges. You talked about the labs. You've been able to confirm to us that we're doing about 40% capacity. But this is because we're doing molecular testing. Let's look at other forms of testing. FDA in America only yesterday passed the saliva test from Yale. Can that be in the works, to be able to ramp up testing? Because when you talk about COVID, you talk about testing. And are we also looking at other methods, of testing?
So thank you very much. I agree there are many challenges. And I think before I get to your specific question, the bigger challenge for us, I think, as a country is how to re-inspire young people to choose a career in science and to choose a career in molecular diagnostics, in biology, in these things that are on the underlying capacities that we need to develop as a country. Sometimes we've struggled to find the right skills, people with the right attitude, people with, the willingness to go over and beyond what it has taken. But at the same time, we've seen people, Nigerians, young Nigerians, rise to this challenge, and collectively, they have inspired each other to keep going at this. And that is really what will drive the innovation that we need. Because, to have the mindset to develop new testing approaches, we don't want to just be recipients of new technology. We want to be participants in the development of these. And that's really where we're trying to go as a country, within the NCDC and within our sister parastatals. Now, in the specific question around diagnostics, the development of new diagnostics has been, a little bit slow. Yes, there have been many discussions about a 15-minute test or a bedside test. All of these characteristics are great. But until you have a test that actually works, it doesn't matter whether it's 15 minutes or whether it's easy to use. The first question is, does it work? Does it work well enough so that when a doctor says you're positive, you are positive, and when you're negative, you're negative? These are two characteristics of each test that we call the sensitivity and specificity of a test. So we're looking at developments around the world. We are ourselves evaluating, together with the Medical Laboratory Science Council of Nigeria, new tests, antibody antigen tests. All the ones we've evaluated, none of them so far have been good enough to be used for diagnostic purposes. We're going to use one of the antibody tests for a sero survey that we're about to implement to determine how many people in Nigeria have been infected in specific populations. So they're good enough to be used in surveys, but they're not good enough yet to be used for diagnostic purposes. Having said that, this is really a rapidly evolving field. I heard about the announcement yesterday. I haven't read the paper in detail, but there will be a really, I'm sure there will be developments around this space in the next few weeks and months. And this will be a game changer, because the easier testing becomes, the much more powerful we have our ability to control this outbreak. So watch this space for development, and as soon as something useful is on the market, we will grab it with both hands.
Dr. Ihekweazu, let's talk about the vaccine race. You said by next year we'll hopefully have a vaccine, but we know already that some countries are already working ahead. Some countries have even placed pre-purchase orders with either Johnson & Johnson or even with the controversial Russian vaccine, the Sputnik 5. Why is Nigeria part of that race? Why is Nigeria not part of the vaccine trials? Even South Africa has said that, look, being part of that vaccine process is a national imperative. But we have not had Nigeria's name in any of these, although we were told that the vice president had a meeting, was it with Pfizer, to position Nigeria for vaccines. But we've not seen Nigeria try to take a deliberate decision to make sure that we stay on that lane. Are we waiting for aid when the vaccine is eventually found? And then secondly, you mentioned a number of state governments that have been very proactive in the fight against COVID-19. And it was interesting to hear that Cross River, after the initial politicization of COVID-19, is now making progress and cooperating with the NCDC. But I would like you to comment on Kogi, which was another stubborn state at the initial stage. What level of cooperation are you getting from the young man who is governor of Kogi State?
So, Ruben, I think those are two extremely important questions. You know, the first thing to say, you know, Ruben, you've been in journalism for many, many years. You know, many of us look up to you, have read your articles for, you know, decades. You know, what you see at the moment for a race to a vaccine is a failure of global leadership. You know, countries should not be fighting for vaccines like children fighting for a toy in a playground. You know, when we had a multilateral world where collaboration and cooperation was the norm, you wouldn't have seen a fight like this. You would have seen countries come together and agree on an equitable way to access vaccines, recognizing that every life matters. And the life of someone living in one part of the world does not have more value than someone living in another part of the world. And public health and health security is not something you can control on your own. You know, you have to control populations because the world is so connected. You know, none of us can lock ourselves in our bedrooms and stay there. We live in an interconnected world. So if your neighbor is not protected, it makes absolutely no sense for you to hyper protect yourself if your people around you are not protected. So we need more multilateralism, and Nigeria is participating in this multilateral effort. There's a big effort called COVAX, led by groups called such as Gavi and CEPI, that are working hand in hand to enable equitable access to these vaccines when they become available to many countries in the world. We are engaging on these multilateral aspects, and that is what we should do. I don't think that Nigeria and Ghana and Togo and South Africa should all be competing. Rather, we should come together as a bloc, working through the African Union, the Africa Center for Disease Control, collaborating with the World Health Organization through the COVAX facility, with the global bodies like Gavi and CEPI that are working together in our own best interest. So that's really what we're doing. And then planning very early through the National Primary Healthcare Development Agency for the distribution mechanism. And we're lucky in that aspect, actually. We do have a fairly sophisticated distribution mechanism with storage and cold chain all assured across the country. So, you know, I'm fairly confident that at the end of the current politicization of access to vaccines, that we will end up in a place where most of the world will come together, even if a few countries insist on going it alone. And if they do go it alone, they will pay a price somehow or the other, because we live in a global world, a global village, and this is the only way things like this can work. To your second question on Kogi State, right now we have a team in Kogi that is trying. So, you know, our mandate as the Nigeria Center for Disease Control is to support states in their response. We really don't have a choice. We can't say we will support one state or not and not the other. So our role is to keep trying. Whether we get the political support that we need or not, whether we get collaboration from the state governments or not, we will keep trying. And I also believe that eventually His Excellency, the governor of Kogi State, will come out, because this is really not this is not a political issue. This is a virus. And like I keep saying, you can't define the transmission of a virus. Kogi is bordered by 9 states of Nigeria. We don't have border controls at our states. We live in a single country. Lokoja is in the heart of Kogi. Everybody traveling north, south, east, west goes past this town. So for all, in my understanding of disease dynamics, distribution, transmission, Lokoja being the transition point of almost everyone in Nigeria, given that we have an outbreak across the country, we should be seeing a lot more cases out of Kogi State that we're able to. So we need to work closer with the state government. And we want to see a much closer relationship, a working relationship, technical working relationship. We need to leave out our political leaders from this. Just allow us, the technical people, the space to do the work we need to do to protect the health of Nigeria.
Well, let's talk about the national response in general. And let me ask you if you are satisfied with what you're seeing. I mean, for the 3rd consecutive time, we have we've currently actually shifted the easing of the lockdown. Actually, we've maintained the phase 2 of the easing of the lockdown. What is so important? What is so particular about this phase 2 lockdown? Why are we static with phase 2? If it's not working, why aren't we considering a reversal? And if it's working, why are we not moving to the next phase of the ease of the lockdown?
And that's why I think, thank you very much for that. If you think about how our response has been structured, and we look at the response across many countries, I think the good thing to say about how the national response has been structured, Mr. President has really put a group together, the Presidential Task Force, giving them the authority and the space to provide leadership, and accepted their leadership and advice. And you haven't seen, as you've seen in some other countries, controversy between Mr. President and his leadership team. So I think I've really been inspired to work within this incredible group of people led by the Secretary to the Government of the Federation, who sit down. Previously, it used to be every single day. Now it's 2 times a week to deliberate on the very hard decisions that we have to make for the country. Now, if you think about the balance that we have to find between the increasing number of cases and the risk, the associated risk of transmission versus the need for people to return to some livelihood, the economy to recover, for funds to get into the economy in order for us to be able to sustain this response. It's a very difficult balance. And for every single decision, whether it's around curfews, schools, airports, whatever we've had to decide, it's been very tortuous, very vigorous debate on how to calibrate these very difficult decisions. The Secretary to the Government and the Chair of the PTF have been very patient, listening to all sides of the argument at every point. So when we come with our data from the public health side, from the number of cases, there's also data from corporate Nigeria, the impact of the economy. There's data from the CBN from the airflow. There's data from the security forces. When we had the strict lockdown, after a few weeks, we saw an increase in the number of security incidents. So these are very difficult decisions. In fact, I'm happy that I am not the one having to make these decisions every day because they are tough. So I think by staying in phase 2 for so long, it's just recognizing that, this outbreak is not over. But at the same time, we need to find a balance where some level of activity can return so that people can cautiously reopen different sectors. And that's what we're doing now with the aviation industry. The Ministry of Aviation is working very carefully with the Ministry of Health and many other partners to find a safe way to open international travel. The next big area, which we will all have to work on together, will be schools and universities. And every country in the world is struggling with the same issue. But there are no simple, keeping schools closed has consequences. It has consequences on health, it has consequences on our social fabric, on security. So while we grapple with these hard decisions, we ask for patience from Nigerians to bear with us as we try and give the president the best advice possible to take our country forward safely over the next few months.
All right, Dr. Ihekweazu, time is not our friend. So in about 4 minutes, briefly, if you can answer this. Number one, what are you doing as regards bringing a lot of universities in this research to be able to fight COVID, synergy with university at a time like this? Secondly, we used to have a vaccine production site in Yaba in the 70s that a lot of people talk about. When the vaccines are out, is this something you resuscitate or the government resuscitates? Because I look forward to a day where we can even produce COVID vaccines in Nigeria, if it's possible.
Absolutely. So to your first question, we've recently formed a Nigerian COVID Research Consortium. This is co-led by the Nigeria Center for Disease Control and the Nigerian Institute for Medical Research in Lagos. But we have also brought in as co-collaborators Tech Fund and the universities group in Nigeria. So together we are working. A secretariat has been set up. Fund has put some funds into it. We're looking for funds from the private sector. I was talking about the National Universities Commission, and you see, so really form together to find ways to raise funds, and with those funds, put out some applications, enable people to apply for grants to start doing the research that we need to do. So there's some of this work, like this example, which we can do, engineer ourselves. But the rest is really to encourage universities. Now, every university has to step up. It's no longer enough just to teach. Every university has to step up their research agenda, and I think that many academics across the country that are pushing very hard in this regard. Remind me of your second question.
The Yaba Vaccine Center that used to be noted as Center of Excellence.
Yeah, yes. So, absolutely. Historically, we used to produce specifically the yellow fever vaccine in Yaba. Now, the model of public sector vaccine production is really not existent almost anywhere in the world. So I think the lifespan for that facility as a public sector-driven facility really came to an end. What the Ministry of Health is now trying to do is a public-private partnership to reinvigorate that center using a different model. And this is really where our strengths lie in Nigeria, but we're not using it sufficiently. And how do we bring the private sector, corporate Nigeria, into some of these areas that service the health sector, that don't need to be delivered directly by the public sector? And there have been many examples in India, in Brazil, where these models work. So we need to look at these models and move away from the model where everything is directly public sector finance, because the government just can't do it all. But I think I'll pause by saying this outbreak and our response to it must lead to a complete change in thinking about science in Nigeria and how we in the public sector, but the universities, academia, corporate Nigeria can come together to provide an infrastructure needed for science, because not as a charitable project, not as something your CSR, but something you have to do because our existence depends on it. If we don't develop the skills to fight this virus into the future, we will pay a price. And that's what we are trying to do at NCDC with our staff and encouraging every other similar organization, state and across the country.
Well, thank you very much, Dr. Chikwe Ihekweazu, for joining us this morning on The Morning Show. We look forward to another conversation with you soon.